Hey everyone, my name is Jamie Springer. I'm a fitness instructor at CFB Wainwright. My main specialty when I'm teaching is speed and agility and strength. So today we're going to talk a little bit about plyometrics, take you through a nice easy workshop, and hopefully you'll laugh a little bit at the video. The mechanical model of plyometrics states that when elastic energy is increased with a rapid stretch to be stored until it's released through concentric muscle action. Therefore, it increases the total force production. Within this model, there are two main components, the series elastic component and the stretch reflex. The series elastic component acts like a spring, so when it's lengthened, the energy is stored, and it remains stored until it contracts to release that energy. The stretch reflex is simply the body's involuntary response to an external stimulus that stretches the muscle. Aside from the mechanical model, proper landing mechanics are crucial in plyometric training to avoid injury. These types of mechanics can include knee valgus and varus upon landing, or when your knees face excessively inward or outward. From there, proper body alignment ensures the member has a firm center of gravity and stability to land or execute the movement safely, both before, during, and after the movement. And finally, learning how to properly absorb forces when jumping and throwing can decrease the risk of injury. The amortization phase is one of three phases that occurs within the stretch shortening cycle of performing plyometrics. This stretch shortening cycle uses the spring action of the series elastic component and the stimulation of the stretch reflex to initiate a max increase of muscle recruitment over a minimal amount of time in order to produce the highest force possible over the shortest amount of time, which is basically the definition of plyometrics. The first phase is eccentric or lowering phase. Here the energy is stored and muscle spindles are stimulated because of the stretch initiation. The second phase is amortization, or pause between phases 1 and 3. Here nerve signals are being transmitted to the muscle. In lower body movements, this occurs when the foot is flat on the surface in transition. In upper body movements, it's the transition between counter movement and release. The longer this movement is, the stored energy becomes depleted and no force can be generated to complete the movement. The third phase is concentric or shortening phase. Here the energy is released and the muscle action is stimulated through the muscle spindle. Following the FIT principle of frequency, intensity, time, and type, intensity can be altered based on the training age and the overall experience of the member. Like all fitness programs, intensity must be progressed at a gradual rate, paired with adequate recovery. Factors influencing intensity include points of contact or number of throws, speed, height or distance, body weight, and surface area. This also applies in the warm-up preparation. Build on the skill using quality repetitions of dynamic and specific exercises to prepare the body and surrounding muscle groups and joints accordingly. If you feel you're inexperienced with plyometrics in the beginning, take the time to learn the movement and progress it how you see fit. If you're more advanced, challenge your weaknesses in the movement and master your plyometric training. Lower body exercises, ranging from low to high intensity, include stationary jump squats, single leg change of direction hops, ranging from quarter, half, and full turns on both non-dominant and dominant legs, and alternating forward bound, but a little bit more exaggerated in real life. Upper body exercises ranging from low to high intensity include overhead med ball slams, explosion push-up variations, and behind the back medicine ball throws for distance. Just pretend the medicine ball actually went backwards, and it went really far. See? Really far. When training plyometrics relative to the frequency, or number of sessions per week, keep in mind that volume comes into play for overall training. When introducing plyometrics into your general routine, it should balance accordingly with resistance training while also taking into consideration adequate recovery again. High resistance training translates to low plyometric training, or about 1 session per week, whereas low resistance training translates to high plyometric training, or about 2 to 3 sessions per week. These plyometric sessions can either be included into a resistance training program as accessory movements or trained individually on separate days. Intensity should be monitored as well relative to overall volume of training. Plyometric training days should not be prescribed no more than 2 days back to back. And if you don't believe me, the whiteboard says it all. Just squint a little bit. Because plyometrics are an explosive, powerful movement, members need adequate rest time between single repetitions or single sets based on their training. Plyometrics are meant to be done for quality and not quantity. That's why programming them using set, rep, and rest schemes is easier versus with time. A good work-to-rest ratio example would be if one set of 5 overhead med ball slams took you 20 seconds to complete. You would therefore rest 1 minute after. It's pretty simple math. If you're performing plyometrics the correct way, which is max effort over a short period of time, the rest will be appropriate. You can always rest more with exercises that are more difficult or higher intensity. In plyometric exercises, a counter movement is used to initiate movement successfully while assisting to produce force over a short amount of time. In lower body exercises, this means using your arms to propel you in the direction of your jump, either horizontally or vertically. In upper body exercises, this means rotating your body to cock back or wind up before initiating the throw to create more force production. In both lower and upper body plyometric exercises, triple flexion and extension occur in the body. The name creates the visual for the ankle, knee, and hip joints in movement. Creating these two positions allows members to accelerate and decelerate forces appropriately throughout the movement pattern, while reducing the risk of injury, as well as creating balance and maintaining stability through the necessary lower body joints to execute the jump or the throw. As previously stated, one factor that increases overall intensity in plyometrics is height. Whether you're jumping up onto a box, landing down from a box, or adding in a throw while landing from a box, height matters. Whether the surface you're landing on is tall or short, the same landing mechanics apply. Once you lose those mechanics, or you can no longer land safely, the height of the box is then too high, and you should immediately reduce the intensity by lowering the height. In this case, less is more. The surface area of the box must be sturdy enough to land on without sliding of the feet or the box itself. Place the box against a wall for added support and safety. Always step off the box when performing a depth jump, and don't jump off. Jumping off shifts your center of gravity, which can in turn increase the danger and affect how you land. Stepping off creates balance and body awareness while keeping proper body alignment. Body weight is a factor too, so anyone over 220 pounds should not jump or land from a surface greater than 18 inches. Prescribing plyometric exercises in different planes of motion allows members to gain training experience and confidence in movement execution. Using various planes allows members to understand the center of gravity relative to the throw or the jump, as well as focusing on balance, stability, and multiple directions. So using those planes, the sagittal plane, the transverse plane, and the frontal plane will all help you tailor your plyometrics training and ultimately advance in this type. One of the easiest ways to train in planes is by changing direction. You can simply increase the difficulty in the exercise by rotating the body position or landing in a different location. Some examples are a half-turn jump squat, a side-facing hip medicine ball throw, or an alternating bound to broad jump. Experiment with different planes and directions to give your plyometric training the ultimate advantage. Like any sort of personalized or unit programming, prescribing exercises that focus on both double and single support are required to improve overall function from day-to-day activities, common military tasks, and both recreational activities. The level of difficulty is easy with mostly any double support jumping or throwing action, but the difficulty increases when asked to use one foot or one arm for support. We all have a dominant side of our body when we're training, so that's where unilateral training comes in handy. Remember to always perform exercises on both sides of the body to increase overall plyometric experience. Not all unilateral training has to be difficult. You can throw in some bilateral requirements in the movement as well. Bringing it back to intensity and frequency, start off small to gain confidence and learn the movement. When you're comfortable, add in some double support or more single support aspects. Some examples of unilateral movements are single leg snap downs, or side to side figure skaters.